All right, today we will be covering Chapter 1, Introduction to the Body. Um, as I kind of mentioned before, these first couple of chapters are really important. Having a good understanding in these is going to make the rest of the semester just super easy. This is kind of our foundation for everything else that we're going to be learning. So be sure to really dive into these chapters and have a thorough understanding of them. So to start, we're going to talk about the difference between anatomy and physiology. So anatomy is the study of the structure of an organism and the relationship of its parts, while physiology is the study of the function of the living organism and their parts. So anatomy is kind of a broad, we think of physical things when we think of anatomy. Physiology is more the cells and the functions of the systems. So for example, the urinary system, the kidneys and the bladder, all of that is anatomy. The actual creation of urine is going to be the physiological portion of that. The levels of organization. So this is going to influence the body structure and function. So we'll start with the microscopic level. This is going to be chemical, cellular, and tissues. So the chemical level is atoms and molecules. Excuse me. Cellular levels are going to be cells, which are the smallest living structures. Tissues are the organization of many cells that act together to perform a common function. And then on the gross level, we have organs, which are groups of several different kinds of tissues arranged in a way that allows them to act as a unit to perform a special function. And then we have a system, which is an organization of varying numbers and kinds of organs that work together to perform functions in the body. So one thing to think about when we're looking at the levels of organization, each one is going to build upon each other. So we start with the chemical level, then we build into the cellular level. The formation or grouping of those cells is what creates our tissues. Once those tissues start to work together and form together, they create our organs, and then the organs as a whole create the systems. So just keep in mind that it's kind of a revolving process. They all build on each other. Anatomical position is going to be the reference position for all body direction terms. So in this position, and there is a picture on page 7 and on the next slide if you're following along with your book. But the body is going to be facing forward, feet facing forward, and the thumbs are pointing laterally, which means that they're pointing out to the side. The pinkies are going to be close to the thighs. The body has bilateral symmetry, which means that if you put a line right down the middle, it looks even on both sides. It's a mirror image on both sides. This is important to know anatomical position because every directional term that we learn is assuming that the body is in anatomical position. So be sure to recognize how the body would sit when we're talking about these terms too. If the body is not in anatomical position, it is either supine or prone. So supine is going to be flat on the back, while prone is laying on the stomach. So here's that picture of anatomical position. You can see the palms are facing forward, toes are facing forward, thumbs are outside, so lateral. Pinkies are going to be medial or towards the midline of the body. Symmetry throughout. So here we have those anatomical directions. So superior is going to be towards the head or above. Inferior is towards the feet or below. Anterior is in front of. Posterior is back or in back of. Medial is towards the midline, and lateral is toward the side of the body or away from the midline. So if we go back to this slide here, if we're going up That's the superior, okay? Down towards the feet, inferior. The thumb here is lateral, while the pinky is medial because it's towards the midline. So it's kind of a relative term. If the pinky is medial, it's not necessarily at the midline, it's just going towards the midline of the body. So if we think about this in terms of organs, we're going to know that the heart is superior to the stomach. So the heart sits above the stomach. Spine is located posteriorly because it's in the back of the body, it's behind. Some other terms that you might hear are going to be ventral and dorsal. So this is common in humans because we walk in an upright position. So ventral is towards the body or the belly, towards the belly, and can be used in place of anterior. Okay. Dorsal refers to towards the back, so it can be used for posterior. So you'll hear it both ways, posterior or dorsal. Know that they both mean towards the back. The way that I always remember this is the dorsal fin of a shark is on the back of their body. So dorsal is back. Some more terms here. Proximal is going to be toward or nearest the trunk or nearest the point of origin. So the trunk is going to be the torso. Distal is away from or farthest from the trunk or a structure's point of origin. So the elbow is going to lie at the proximal end of the forearm, where the hand lies at the distal end. So if we think of the point of origin as the shoulder, the elbow is closer to the shoulder, so it's proximal, whereas the hand is farther away, so it's going to be distal. Okay. And then the last two are superficial and deep. So superficial is closer to the body surface, while deep is farther away. So if we look at the arm again, the skin of the arm is going to be superficial to the muscles below it. So the skin lies on top of the muscles, closer to the body surface, whereas the bone of the arm is going to be deep to the muscles. So it sits below those muscles, farther away from the body surface. This slide is just a reference. If you go back to this, you'll see this little compass down here. So that's just, this slide is just giving you what those directions mean on that compass. So just a reference if you need it. Planes of the body. So a plane is going to be an imaginary flat plate that runs through the body. So this is used to subdivide the body or organs into smaller sections. If we break them up in these planes, it makes them a little easier to study. So a sagittal plane is going to be a lengthwise plane that divides the body into right and left sections. So imagine splitting right between the eyes, down the nose, all the way down. That's going to be a sagittal plane. Mid-sagittal means that that sagittal plane has divided the body into two equal halves. So again, going back to this slide here, we can see that this plane here has divided the body into two equal halves. That's going to be your mid-sagittal plane. A frontal plane is the lengthwise plane that divides a structure into anterior and posterior portions. So front and back. So this is going to be, from shoulder to shoulder, lengthwise. We've divided it into front and back, anterior, posterior, or else ventral or dorsal. Those are all going to refer to the same thing. And then our transverse plane is a horizontal plane that divides a structure into upper and lower parts. So imagine that you run a line from hip to hip, up above, and then down below. So superior, inferior, or upper or lower. Here's a diagram just depicting all of those different planes. So now we'll get into body cavities. The two main components of the body are going to be the dorsal cavities and the ventral cavities. So if we think back to those medical terms that we just learned about, the dorsal cavities are going to be posterior. So that's the cranial cavity and the spinal cavity. Ventral cavity is going to contain the thoracic cavity and the abdominal pelvic cavity. Those are both located in the torso or the trunk. So the diaphragm is going to separate the thoracic and abdominal pelvic cavities. The upper ventral cavity is going to be the thoracic cavity. It also contains the mediastinum, and then the right and left pleural cavities. And then the lower ventral cavity is that abdominal pelvic cavity. So that's the abdominal cavity and the pelvic cavity, but there is no physical partition that exists between them. So there's nothing separating those two cavities. That's why we get the term abdominal pelvic. So here is a picture showing those different cavities. As you can see here, we've got the diaphragm separating those two, the abdominal pelvic here, and then the thoracic cavity here. So within the thoracic cavity, we have the mediastinum and then the pleural cavities. So the mediastinum is going to be this red line here. It houses the heart. Okay? Pleural cavities sit on either side. Bear with me while I draw this P here. And those are going to contain the lungs. Now we'll look at quadrants. Knowing these quadrants is super important. It's used by health professionals for locating pain or abnormalities. If a patient comes in and says, "Oh, I've got this pain," and they're pointing to their right lower quadrant, it might be the appendix. So we know that that's kind of where we need to start to look. So divide it into right upper, right lower, left upper, and left lower. So depending upon where that pain is, we can kind of determine which organs are involved, what the issue might be. And because that's not simple enough, they decided to break it into 9 different regions as well. So we'll start at the top. We've got the right hypochondriac region, the epigastric region, and the left hypochondriac region. When we're thinking about these regions, it's important to remember that the patient is in anatomical position. So if we're facing the patient, we don't want to confuse our right with their right. So if they say, "Oh, I have pain in this area," keep in mind that it's their right, patient's right. We always go by the patient's body. The middle area is going to be the right lumbar region, umbilical region, and the left lumbar region. And then the lower area is that right iliac region, hypogastric region, and the left iliac region. So if we look at kind of the terms here, it's helpful to decide which location each is referring to. For example, that middle row, we've got the umbilical region, so we know umbilical is belly button. So that's kind of right where that region sits. And then the right and left lumbar regions, that's about where your lumbar spine is. So we can use that as our reference point to determine the name of that region. Down below the umbilical, we have the hypogastric. Well, hypo means below, so we know that that one is below the gastric or below the stomach. So just using that medical terminology, kind of piecing those terms together can help make it a little easier to remember. So then we have the axial and appendicular skeletal divisions. So the axial region is going to be the head, neck, and torso, and then the appendicular region is the upper and lower extremities. This one's pretty simple. The one part that does get a little bit confusing sometimes is we have to remember that the pelvic girdle right here and then the shoulder girdle here are considered parts of the appendicular skeleton. So even though we think of them as housed inside the torso or trunk, they're actually part of that appendicular because they are part of the upper and lower extremities. Different body regions found in that axial and appendicular skeleton. All right, so now we'll talk about the balance of body functions. The state that the body is trying to be in at all times is called homeostasis. So this is a relative constancy of the internal environment. We always want to be in a homeostatic state. So in order to do that, our body goes through what's called feedback loops. So this is a control system through the body. So the nerve endings are going to feed information to a control center in the brain that then tells the body that something needs to change. We'll go about making those changes. Excuse me. So there's two different feedback loops here. A negative feedback is going to oppose a change in a controlled condition. So this is the most common one. The easiest example is us sweating. So we're outside, we're working, it's blazing hot, we start to sweat. So what's happening is our body is trying to bring that temperature back to a normal level. Positive feedback is a little more unusual. So this is a temporarily amplified occurring change. This is what happens when a woman goes into labor. So we have increased uterine contractions, so we're amplifying those contractions until the birth of the baby occurs. So most of these control loops are going to be negative feedback because reversing a change back towards normal is going to be easier to stabilize that condition. It's cold outside, we start to shiver, the body warms us back up. That's a negative feedback. Positive feedback, that ever increasing rate of events doesn't occur very often. So it's mostly childbirth and then blood clot formation. This just compares the process of the feedback loop to a furnace, which is a good example. And then here's that positive feedback loop. So again, those contractions increase, increase, increase until the child is born. Keep in mind that these controlled conditions don't remain absolutely constant. Body temperatures are going to fluctuate. There's always a normal range of something. So your body temperature doesn't have to be 98.4. You know, if we're off even a degree or two, the body is okay. It's not going to cause us to sweat or shiver or anything like that. So we want those conditions to fluctuate near the ideal value. As we age, the ability to maintain that balance changes. So in the early years, we're going through developmental processes. After we get to young adulthood, we begin the aging processes. So, you know, sometimes as we age, those functions tend to deteriorate a little bit. that is the end of chapter 1. Read through the chapter, make sure to do anything within that chapter that'll help you understand these concepts. And then, of course, email me, call me, let me know if you have any questions at all.